A-fib versus A-flutter. First, let's look at A-fib. Notice how this rhythm is extremely irregular, irregularly irregular. There are no discernible P waves. There are fib waves because the atria are fibrillating. They're not pumping. It almost looks like artifact on the monitor. Also with A-fib, if the patient also has a rapid ventricular response, this is called A-fib with RVR. So remember, A-fib, always irregular, no discernible P waves. Next, let's look at A-flutter. So this is still an atrial dysrhythmia, right? But this is a very regular rhythm. Still, the atria are pumping very rapidly. But there's a characteristic sawtooth pattern that you notice with A-flutter. So A-fib, very irregular. A-flutter has a sawtooth pattern and a regular rhythm. Quickly, let's talk about the patho of A-fib and A-flutter. Both of these are caused by re-entry circuits, or basically a funky pathway that keeps allowing electricity to circle back through the AV and SA nodes that causes the fibrillation or the flutter of the atria. And so this is why a lot of times these patients end up having to have cardiac ablations where that funky electrical pathway is totally ablated, ending the dysrhythmia. So as the nurse taking care of patients with A-fib and A-flutter, we have two overarching goals. Number one, we want to maintain cardiac output. Sometimes these patients, their cardiac output will decrease because their heart rate is so rapid, and they'll start feeling dizzy. They'll start feeling faint, lightheaded, blood pressure will drop. So we need to control the heart rate with things like calcium channel blockers, beta blockers, digoxin. Number two, we have got to prevent blood clots because remember, the atria are not contracting and pumping efficiently like they're supposed to. They are quivering, so blood is going to pool in the atria and possibly clot. So these patients are at a very high risk for a stroke. So this is why anticoagulation is a staple for patients with A-fib and A-flutter. Hope this has helped. Follow for more. Go Vols.